Thank you so much, Erica, and welcome everyone. We're excited to have you join us today. I am just going to share my screen. Fantastic. Well, welcome everyone. My name is Alexis Guild. I am the Director of Health Policy and Programs at Farmworker Justice. This is what we'll be talking about today. We're going to provide an overview of Migrant and Seasonal Head Start. And then we're going to go into the meat of the presentation, which will be talking about your partnership with Migrant Seasonal Head Start, what makes a strong partnership, and then some strategies and challenges around developing and strengthening relationships with Migrant and Seasonal Head Start. Farmworker Justice is a national advocacy organization. We're based in Washington, D.C., and we seek to empower farm workers and their families to improve their living and working conditions, occupational safety, and health. And we use a multifaceted approach, including training and technical assistance, coalition building, and public education.
Hello, everyone. My name is Guadalupe Cuesta, and I am the Director of the National Migrant and Seasonal Head Start Collaboration Office, based also in Washington, D.C. We're a national office designed to promote high-quality direct services to migrant and seasonal farm worker families and their children. And our role is basically to collaborate. Any opportunity that we can find to collaborate is something that is important for services to migrant and seasonal Head Start families. We foster new partnerships like the one with community health centers and, of course, with Farmworker Justice. A little bit about Migrant and Seasonal Head Start. Migrant and Seasonal Head Start is one of the largest community-based service providers in the nation, and we provide a great range of services for migrant and seasonal Head Start children and their families. The children we serve are ages birth through compulsory school age, and their families every year. The Migrant and Seasonal Head Start program provides education support services to low-income children of migrant and seasonal farm worker families. Head Start programs deliver services to children, families in core areas of learning, health, which is the partnership that we seek with community health centers, and families' well-being while engaging parents as partners every step of the way. And just to show you where we have programs, we basically have 38 states that we provide services to in those areas. Next slide. Okay, so one of the things that I wanted you to understand about Migrant and Seasonal Head Start is what makes a migrant and seasonal Head Start family eligible. First of all, they have to be eligible under the federal poverty guidelines, which are, of course, put on by the federal government. And I think most of you would have access to that. But if you don't, make sure to let us know and we will provide that for you. We serve children, again, birth through compulsory school age, and the whole entire family must have moved within the last 24 months in search of agriculture. It's not once the parents move and the child stays, it's the whole unit that moves, the family unit that moves. And the other income criteria that must be met is 51 of the income must come from agricultural work, at least 12 months before. So every year they have to qualify under this income guideline, whereas income for federal poverty guidelines are only met once for 2 years. So we have two definitions, and here Migrant Head Start serves the most mobile of the two populations. We have families who have moved from one geographic location to another in the preceding 2 years. Those are our mobile migrants. And then we have families who are seasonal farm workers who no longer migrate but still work in agriculture. And when we have, the priority always goes to the most mobile of the migrant children. So just a little bit about how our children receive services. And one of them is through, of course, insurance. And I have to say, the majority of our children qualify or do have some type of health insurance. Every year, we have about 10% of the families who do not qualify. And this is where I think our collaboration together is very meaningful. There's also, we provide auxiliary services. We have about 50 programs out of the 62 that we serve that provide transportation to children to and from the center. And they can be from 4 o'clock in the morning till about 6 o'clock in the afternoon. All programs must provide services by a professional licensed nutritionist and a behavioral health provider. Now, not all partnerships are created equal. So, Alexis, I think this is your.
Yes. So thank you, Guadalupe. So in terms of partnerships, every partnership is different. And every partnership has its own way that it was formed, its own level of collaboration. And one partnership with one organization may and likely looks very different from your partnership with another organization. So thinking about your partnership with Migrant and Seasonal Head Start and your partnerships in general, we have this collaboration spectrum. Essentially what it is, it's a way to think about your collaboration and where you are on the spectrum. Trust is when you are fully integrated, and this is when the two organizations are fully trusting of each other. They work together very closely. Their programs are very much intertwined. And then at the other end of the spectrum is compete, which essentially means that the two organizations are competing for turf. So you are in the same area, but you don't work together at all. Actually, what you do is you work against each other because you are worried about having enough people for your services. So instead of working together, you work completely apart. So every collaboration, as I said, is different. And your collaboration with Migrant and Seasonal Head Start, if you have one, likely is somewhere along this spectrum. Maybe you coexist. So you know of each other, but you don't work together, but you're not competing with each other. Or maybe you are collaborating and you've had a long-term partnership and you work together on shared decision-making and resources. Or maybe you're in between. So we would like to take this opportunity to have you think about your partnership. If you are not currently a partner with Migrant and Seasonal Head Start, we would like you to think about a partnership with another organization in your community. If you do currently have a partnership with Migrant and Seasonal Head Start, we would like you to, in your breakout room, think about where you would place that partnership on the spectrum, what the partnership entails, and do you have what we call a memorandum of understanding? And we'll talk more about that after we come back from the breakout room. But looking at this collaboration spectrum, we want you to discuss in a small group about your partnership and where you might be on the spectrum. So I am going to ask Ron to place everyone into breakout rooms. And we will be there for about 10 minutes. And then we will come back and we will have a large group discussion.
Sounds great. I'm going to open up the breakout rooms now.
Welcome back, everyone. Let me bring the PowerPoint back up. So I hope that your conversations went well. Whoops. Let's talk a little bit about, hold on one second. Let's talk a little bit about your discussions. Would anyone in the chat, or if you want to unmute yourself, would any of you like to share about your relationship with Migrant and Seasonal Head Start, what that looks like? Did many of you place your partnership on one end of the spectrum or other? Up, I see someone unmuted themselves. Hi.
I did. Hi, my name's Yamilet. And the reason why I wanted to be a part of this conversation is because there's definitely opportunity for partnerships. It just makes sense. Now, I was invited to this conference for my Head Start. So we do have conversation, following up conversations on Monday, which I'm really, really looking forward to. But there's definitely the opportunity to communicate and to truly build a partnership around healthcare access. The pandemic has uncovered health inequities with the most vulnerable population. Here in the state of California, where I'm from, this is the community that was the hardest hit and continues to be the hardest hit. And so it's very critical and important that we work on those inequities. If we truly want to make change, we need to ensure that healthcare access is there, that we're working together towards these common goals, and it just makes sense. So it's really important that if there is a Head Start in the area, all the people at my breakout room, we were all health related, either health centers, FQs. But so we didn't really touch base with the Head Start. But I would love to have possibly a Head Start that already has a partnership built to touch base and talk to us a little bit more about that. I just feel like either having mini health fairs, having vaccine clinics, 3 to 6 p.m. when people start coming in to pick up their children, having mammograms. I mean, there's so many opportunities, bringing our mobile vans. We have those services as FQs, federally qualified health centers, that I just feel that it just makes sense. Thank you for letting me speak on that.
Thank you for sharing.
That's exactly what we wanted to do is if you're not engaged yet in a formal MOU or a partnership collaboration, then this is a way to start. And thank you for sharing that.
Thank you. You're welcome. Happy to share.
Would anyone else like to share? Would anyone else like to share about their partnership, where they placed it on the spectrum, why they placed it there, or anything else you'd like to share about either your current partnership with Migrant and Seasonal Head Start, or if you don't have one, what resources, what do you hope to build with Migrant and Seasonal Head Start? You can also type into the chat if you're more comfortable doing that. And Guadalupe, I don't know what you're thinking, but and when Yamilet, is that how you pronounce your name?
That's a beautiful name, by the way. Yamilet.
Yes, it's Yamilet. Thank you.
So when sharing about what you hope to do with Migrant and Seasonal Head Start, and we were talking in our breakout room, many of the health centers primarily do medical care for the Migrant and Seasonal Head Start children and families, and that's really important. But it's also important to think about the other ways that you could work together. And you talked about the health fair, but also, vaccination clinics for the families, sharing resources, food distribution, especially during this crucial time. And Migrant and Seasonal Head Start can be a great partner. And, it's not just about thinking about the partnership. For us, it's about the children, absolutely. But it's also about that whole family health that you talked about, and about making sure that the family has a medical home, even when Migrant and Seasonal Head Start is not there. And that all of the whole family, from the youngest to the oldest, are able to access the health center, are comfortable accessing the health center, are knowledgeable about the health center.
Exactly. And I think also a big opportunity is to hold support groups like mental health, around mental health. Have our MSW, as licensed clinical social workers, hold a support group there. I think it's very important because there's a lot of things that need to be addressed. Mental health is a really, really big one. And there's a lot that this community is carrying, a lot of a very heavy burden. And I think as community health centers and FQs, as our mission is to provide quality healthcare access to the community, regardless of these barriers, I think this is a great opportunity to be able to utilize our mobile clinics, our mobile units as well. But also let's talk about mental health. I think it's a great opportunity to ensure that we're utilizing that piece too.
We have someone, Vicky, raising their hand.
Yeah.
Vicky?
Just 1 second. Yeah. I'll lower my hand first. So I'm Vicki Jeckett. Hi. I am based in Boise, Idaho, where we're predominantly white Caucasian. However, we have a higher percentage, and it's growing, of Hispanic community members. I work for a health system, St. Luke's, here in Boise, but we do have locations across the southern Idaho area into Oregon and northern Nevada. But specifically with Head Start and the migrant workers as such, we have a couple of programs. One is the Health Window in collaboration with our Mexican consulate here. And we just started. I have a direct report who is completely focused on the Health Window, which is a collaborative partnership with the Health Window at the Mexican consulate. And we've started to work in collaboration also with Head Start. And because of COVID, we haven't had the benefit of bringing a mobile, doing the health fairs, because everything's been shut down for obvious reasons from a pandemic point of view. But we've pivoted, just like with Zoom, through a virtual presentation. So our bilingual coordinator has given some presentations on multiple occasions to the families, specifically in COVID, because that has been the most requested topic for obvious reasons. What is it? What are the vaccinations? But the main thing is understanding the trust factor. So the Head Start program has staff who are very well trusted by the Hispanic community. Not that they don't trust the health centers per se, but they don't have that established relationship over time. So it's been great to be able to partner with the staff and understand what are the other concerns and barriers that we need to overcome. And so it's been great. We're just getting a lot of the efforts off the ground, partnering also with the faith-based community as well, because they're another resource for the Hispanic community as well. So I just wanted to mention it's been great to partner, even if it's just been just getting off the ground, and it's been very successful. So we've had a lot of great positive feedback from the families participating. So thank you.
Thank you for sharing.
One of the things that I'm thinking about is that there is so much that, with the exception of the direct medical services, there's so much that can be shared between Migrant and Seasonal Head Start and the community health centers. I mean, there's a lot of stuff going on that I feel sometimes we're duplicating, or we're working harder because you do education, we do education. You community health centers do community assessments, we do community assessments. We provide case management, community health centers does that, overall family health also. And so there's a lot of things that we can collaborate. And there's some things that we don't have. For example, Tahida just mentioned in the chat that they would love to have the mobile clinics over in Massachusetts come to their program. And in some areas, I know that community health centers send their mobile units to the Migrant and Seasonal Head Start centers. So I think that's something that those are the kind of things that you need to reach out to each other. And that's why we're here today, because we want to introduce you to the world of collaboration, partnerships, and building that relationship so that that whenever one of us needs something, we can call the other.
You have a comment in the chat. I don't know if you all want to review that or at your leisure, but I can read it out if you'd like me to.
Okay.
Yes? No?
Yeah, no, I think that when you're sit down to build that relationship, there's so many areas that you need to discuss and plan for. And referrals is definitely an area that is mutual to both. You know, if the child needs to go see a dentist, if the child needs extensive health services, you know, you sit down, you plan, and you work from there. How's the best way to handle this? You know, who's going to refer the family? Who's going to take the family? There's so many details to that referral. It's not just calling somebody, you know, here's the family. There's more to it. And I think that this is an opportunity that we have right now. One of the things that we've been doing at the national level is working with the Health Resources Services Administration, which is AKA HRSA, and the Bureau of Primary Healthcare. And it took us a while, but we did create a memorandum of understanding about how we want to work together. But first we had to build that relationship. And then what do you offer to families? What do we offer to families? And where can we meet together? So we developed an MOU at the national level, which Alexis and I have been sharing throughout a couple of years. This is the second time we revised it. In 2018 was the last one we did that we looked at and rewrote the MOU. And now we have it for 5 years, but we check in on a monthly basis with each other. But the MOU basically formalizes that partnership between Migrant Head Start and community health centers. And it really details, and I think that maybe, Alexis, we can send it out to or post it up on the resources, that MOU. So you could take a look and see what kind of roles each one has and that we're all committed to doing, the partnership, what it looks like. You know, that MOU has helped a lot to reduce confusion and uncertainty down the road and ensures that the needs of both groups are met and how we can work together and then address the needs of our migrant and seasonal farm workers. If you go back just for a second, and I also wanted to introduce you to the MOU, Effective Partnership Guide. The guide we have also up on resources, and it really helps you establish a plan for planning ahead, explore opportunities to identify resources and existing services, and also how to build a solid business plan, because there is a component of payment for services.
We do have a question, Guadalupe, about who the staff member should be to begin that conversation between the health center and Migrant Seasonal Head Start.
I think each organization needs to contact each other so that they can, I would say that the health, in Migrant Head Start, it would be the health coordinator and the director need to sit down and say, we don't have a formal partnership with our community health centers. How do we begin? And if you look at that guide, it will give you step-by-step instructions on how to begin that whole process. But if not, you can always let Alexis and I know, and we can help you out personally on that. So I wanted to talk about a little bit about what we have been seeing out there as we do this collaboration between Farmworker Justice and Migrant Head Start. We go around the country to Migrant Head Start programs and health centers and look at their relationship. Are they Do they have a contract? Do they have an MOU? Do you have an agreement? Is it legal? Does it involve money? Or does it involve just a relationship? And those are two very confusing things. You know, and a relationship to me means that that's more of an MOU. Contract is for services. There should not be mix-up because it's two different functions of that relationship or that partnership. Next slide.
So we are going to just put up a quick poll to see if you have an MOU or a contract. So I'm going to ask our colleagues at CVent if they are able to launch the poll. And the question is, do you have, based on what Guadalupe just shared, do you have an MOU, a memorandum of understanding, or a contract, or both with Migrant and Seasonal Head Start, or maybe you don't know, and that's okay too, or you don't have either because you're at the beginning of the relationship. So we would love to just hear real quickly from you about if you have any of these in place. So I'm not sure how long you want to keep the poll up. And it looks like a couple people have mentioned that they have neither. So it looks like of those who are responding, some have an MOU. I'm also looking at the chat. Many in the chat are saying MOU. It looks like according to the poll, either they don't have either or they have both, or you're not sure, which is also fine as well. A contract, as Guadalupe shared, tends to involve money. An MOU is more about the other activities outside of anything that may involve money. So if you do health fairs or if you do joint food distribution or joint trainings, for example. So this is great. So it looks like most people don't have either. So definitely a starting off point. And I think we can close the poll now. Thank you so much for that. And let me just go back to sharing my screen. So the other piece is, and just to go back to the question about who should be involved, so everyone at all levels should be involved. So as you're thinking about, creating those connections, and then as you start to work on a memorandum of understanding, which is really what Guadalupe and I focus on, because the MOU goes beyond the medical and clinical and kind of thinks about those other pieces that a collaboration can involve. It's really important to include both C-suite individuals, those who have decision-making power, whether that's the CEO or the CFO or the director of outreach, but then to also include those staff members who have direct contact with the families. So whether that's someone at the patient level, who works directly with patients at the health center, the health specialist at Migrant and Seasonal Head Start, because everyone has different viewpoints and different perspectives and different inreaches, and they can share based on all levels what would be good to include in an MOU. Now, a strong MOU has a statement, a purpose, an intent with a common goal and common expectations. Also, it's pretty simple. You want to make sure that what you write in your MOU is specific and that it is simple to anyone who can read it. So that way, if you leave, if someone else comes in, they can pick up that MOU and continue off from where you left. It's also important to be specific, talk about all the different pieces, all the different activities that you do together, whether that's trainings, health fairs, recruitment, letters of support. And that's because you want to get credit where credit is due. You know, Guadalupe and I often see MOUs and they only say that they will do health fairs together. But then when we talk to them, they say, oh, well, we do trainings together. We do letters of support for each other. And we always say, include that. If you're doing an activity together, include that in your memorandum of understanding, not only for organizational purposes and institutional knowledge, but also if you are going after funding, for example, you can show all the great work that you're doing together and have that documented. It should also be a living, active document. So Guadalupe mentioned that in their MOU with the Health Resources and Services Administration, they revisit it every 5 years, but they meet monthly to talk about their activities. We have seen MOUs that happen once and are never touched again. And the issue is that things change. Like right now we're in COVID, and that has changed a lot of the activities that you do together. And it's important that it's continually monitored and revisited, and that the people who sign onto it are those who have the authority to sign onto an MOU, because ultimately they are the ones responsible for that partnership.
I know it is a challenge through these days of COVID, but to really begin working together. But you know, things are opening up. There's still services. Migrant farm workers are still out in the field. So we have to find creative ways of reaching out to each other. And because of that, MOUs tend to change, as Alexis said. So we need to really look at what strategies we need and what involvement we need to do for that particular MOU and that relationship. I know that sometimes, Alexis mentioned that sometimes they're created once and they're left forever, and you just keep signing them every year. As she mentioned, things do change. Now, one of the things that I think, next page, because you already talked about that, is that right now, most of our Migrant Head Start programs are closed. We do have some that are open, so you need to look at those challenges. But those parents and those children still need those services. So with any of the type of activities, I think that if you discuss them, then those things need to be in the MOU so that you can support the whole family, you know. Okay.
So thinking about kind of what's happening during COVID, and all of the challenges that the health centers, U.S. health centers are facing, that Migrant and Seasonal Head Start is facing, that our farm worker families are facing. How can Migrant Head Start and the health center work together to respond to the pandemic? And I know vaccination clinics was mentioned, but Guadalupe, I don't know if you have thoughts about other ways that can work together. And then what lessons can we apply from what's happening right now and the partnership during COVID to the partnership in the months and years ahead?
Well, right now, I know that Migrant and Seasonal Head Start programs are looking to have the families vaccinated just as the health centers do. So why not set up a time to discuss how to proceed, what processes, what strategies do we need to do to involve or make sure that our families have the vaccination? You know, I know that there's a lot of coordination of having mobile clinics go out to the fields, but also those who are missed in the field and participate in Migrant Head Start can also you could form a strategy on how to do that. Okay, that was a long-winded response.
Does anyone else have any other thoughts about how you can work together during this time of COVID? Or are there any questions that you would like to share or have?
Actually, this is Vicki. Let me just get
Yes.
back on. I was just going to mention in continued partnership, we've worked with the media. So thinking of radio especially, because that's one of the most common sources of information for farm workers and others. So we've intentionally partnered even with the Hispanic Chamber of Commerce, as well as our providers, to put on webinars that are in Spanish and making those available on social media, as well as, again, through the media outlets, in conjunction with our partners like Head Start, so that we're doing really a coordinated effort to get the word out, not only about the vaccination clinics and what's available, but just dispelling the myths, because there's a lot of misinformation out there, which is causing that hesitancy for the vaccinations. And then I continue to provide, information where they are, like you said, at the farm working fields or in the agriculture communities, as well as through the churches, et cetera. So it's a full court press through everybody to try and address this COVID issue, because it's, as everybody knows, it's been such a challenge to reach folks and get them to vaccinations and just the truth about what it's all about. So thank you.
Vicki, that's a great point, because you're trying to reach a wide range of families, but Migrant Head Start also provides parent meetings. They're doing them now on Zoom, and that's a good way to pass on information. So whenever either one has information about the community, then or services, that sharing is so critical.
And I forgot to mention the schools too. So the schools have been another important vehicle. Even though most of them have been online, they're starting to return back to the classroom, but as long as those parents are also getting information too.
Mm-hmm. Any other questions you have or comments? That's my cat. Sorry.
Wants your attention. This was really good. And there are a lot of opportunities. And I think that, the health system working with the education system is critical. It's important. If you don't have a school-based health center already, that's also a huge one for FQs. But this makes sense, and it'll address a lot of health inequities that were uncovered during this pandemic that have been in existence for a long time, and a lot of the social determinants of health. Truly, food access, health access, that's a big one. Childcare access. I mean, here we have it, and we need to ensure that we address some of those issues. So this has been great. Thank you.
Thank you. And Alexis and I are always around to help out, and you have our emails here. And we'd really appreciate a call. For all of you that don't have an MOU and you would like to start that partnership, remember, this is access for health, and that's both of our missions. So I think that's important. So if you need or would like to explore a relationship with Migrant Head Start or vice versa with health centers, please contact us. For those of you who are not sure, we're willing to help you out. And those who have a contract and have an MOU, if you'd like to share those with us, we're always looking to see how we can make changes for improvement on those MOUs and contracts.
And I'll also add, Migrant Seasonal Head Start, and Guadalupe mentioned, these Zoom calls that they're having with parents. Migrant and Seasonal Head Start does a lot to engage the parents. And I think that, and actually, Yahaira, if I mispronounced your name, I apologize, mentioned that parent meetings are monthly. And she's saying, and I was actually about to talk about the education. So she's saying it's important to educate and communicate about the vaccine. And because Migrant Seasonal Head Start has these strong relationships with parents, and really they focus on parent leadership, it's a great opportunity for the health center to come and share information and participate in those parent meetings and share information not just about the health center, but about issues like the vaccine or nutrition or childhood obesity. There are so many opportunities to work together, and those parents are crucial, and they may not be, and maybe eventually also you can get them on your board of directors for your health center, because they already are super active in Migrant Seasonal Head Start. So there are so many opportunities for collaboration, and Guadalupe and I are here to help make those connections and facilitate those conversations so that you and the Migrant Seasonal Head Start, or if you're Migrant Seasonal Head Start, you and the health center can build these connections and collaborations to address those social determinants of health.
We thank you so much for participating in this session. And we look forward to connecting with some of you for those partnerships and collaborations. So thank you so very much for all of this.